My fellow Americans, ask not what your country can do for you. Ask what you can do for your country.
Hello, everybody, and today we have a very, very exciting show dealing with an issue that is of concern, I think, to every man, woman, and child in our country, and that is the need for real health care reform, the need to move this country away from its dysfunctional health care system into a Medicare for all single-payer system. And in order to help us understand what single-payer is about, how it works in our neighbor, Canada, is a friend of mine named Dr. Danielle Martin. And some of you may know Dr. Martin because she's kind of a household name in America now, because a few years ago she had a conversation with Senator Burr, which attracted enormous amounts of attention about the Canadian system, ended up getting 25 million hits on our video. Dr. Martin is a family physician in Toronto. She's the Vice President of Medical Affairs and Health System Solutions at Women's College Hospital in Toronto. Dr. Martin, thank you so much for being with us today.
Thanks for having me. It's an honor.
Let me start it off by saying that I think that there are not all that many Americans who are aware of the fact that we are, in the United States, the only major country on earth not to guarantee health care to all people. That in a sense, we are, in America, the exception to the rule. So let's go to Canada, where you practice as a family practitioner. And let me ask you the simple question. If I am an average Canadian, what does the Canadian healthcare system mean to me? How does it treat me?
You know, if you are the average Canadian, you probably don't think about our healthcare system very much because you take it for granted. You know, my generation of Canadians doesn't even remember what it was like to have to worry about paying a doctor's bill or a hospital bill. So if you were a Canadian citizen, you would have a provincial health card, which essentially links you to the single-payer public insurance plan, which means that you have insurance and it's paid for by the government, and it covers every doctor's visit, 100%, every hospital stay, 100%, all the medically necessary stuff in the doctor and hospital field. So you would come to my office if you needed an appointment or a checkup or blood pressure or whatever, and you would simply present your health card, and we'd write down your number.
And what is my deductible?
Zero.
What is my copayment?
Zero.
Okay. Now, you mentioned yesterday you have, what, one child?
Yes, I have a child.
And how much did it cost when you gave birth to that baby? It
cost me nothing. It cost me nothing for my prenatal visits, nothing for my ultrasounds. They were following her a little bit more closely, so I had quite a few ultrasounds. Cost me nothing for those. My labor or birth, hospital stay, cost me nothing. I handed over my health card, and that was it. It's incredibly simple, actually.
Did you have to fill out many forms?
No forms. I'm sure that's not true. There must have been a form at some point. Somebody must have asked me to write down my name and address. But really, you know, functionally no forms. I never had to apply to be reimbursed for anything. I was not asked for a credit card. I was not asked for anything other than my health card.
All right. Now, what happens if I have one of your colleagues was with us yesterday, and she mentioned that her dad had several serious episodes with cancer. So somebody walks in to make the diagnosis. Somebody has cancer. It's an expensive procedure. Tell us about that journey.
So, you know, my colleague who was sharing the story of her father's colon cancer diagnosis yesterday probably would have gone to see his family physician quite a few times, would have had a colonoscopy, would have had multiple CT scans. He had surgery to take out a part of his colon. If he had had chemotherapy, radiation therapy, covered. All of it, 100%. No copayment, no deductible, no forms to fill out. Now, there are things that are not covered in the Canadian system, and I know we'll talk about that this morning. Notably outpatient prescription medicines, but by and large, a cancer journey in the Canadian system is covered. And our outcomes for cancer are very good, by the way. I think there are a lot of myths that get propagated in the U.S. about, well, if it's paid for by the government, it must somehow be inferior. In fact, our health outcomes are as good or better across a very wide variety of diagnoses as compared to the U.S.
Now, We introduced, as you know, and I want to thank you very much for being with us yesterday for the introduction, along with 16 senators, of our Medicare for All single-payer program. And what we are already hearing from our critics is this is government health care. The lines are never ending. They're going to run out of money. It's a disaster. Half of Canada is fleeing to the United States in order to get their health care, right behind all the doctors who are leaving.
Right.
Is the Canadian healthcare system popular? Do people want to move toward an American-type system?
The Canadian healthcare system is so popular that a few years ago, when there was a public poll done asking people what is the greatest symbol of our country, 94% of Canadians said Medicare, our public health care system, is a symbol of our country that instills in them personal and collective pride. So actually, the support for our single-payer healthcare system among Canadians is overwhelming. There is no politician on any end of the political spectrum who would ever dare suggest dismantling it. They call it actually the third rail of Canadian politics. If you touch Medicare, you get fried. And so, which is not to say that it's perfect. Of course, I want
to get to the problems in a second, but I want to stay on that point. For many years, you've had conservative government, national government, but they didn't come in prepared to end this terrible government health care, did they? No,
not at all. And in fact, we now have a more progressive federal government. There's been a leadership race for the Conservative Party. And there was one candidate in the race for the leadership of the Conservative Party who suggested we should allow two-tier health care, and she was trounced. I mean, it's not politically acceptable to Canadians, and so the support for the system is overwhelming. And when you ask people about their experiences in the system, they tend to rate them very highly, very high rates of satisfaction with the care that people receive. They feel well taken care of. Our hospitals are state of the art. We have all the technology. You need a PET scan. You need a CAT scan. So people should not be nervous about visiting Canada, worried about getting sick. No, they should not be nervous. They should not be nervous. I mean, actually, Canadians worry a lot about being on vacation in the U.S. and getting sick because we know it can be a bankrupting experience. So, I have this conversation with patients, women in my practice who are pregnant. I say, don't travel to the U.S. because you have a pre-existing condition. You could get bankrupted.
Let me ask you this. The fight that we're waging here is both a moral fight, which says that healthcare should be a right of all people, which is the case in Canada and virtually every other major country. Second of all, it's an economic issue. We are spending $10,000 per person per year on healthcare. $10,000. We're close to 18% of the U.S. GDP on healthcare. Meanwhile, in Canada, according to the OECD, you're spending about $4,644 a year. It's about less than half of what we're spending. And by the way, that's the case all over the world. Germany is spending $5,500. France is spending $4,600. The UK is spending $4,100. We in the United States, ladies and gentlemen, are spending $10,000. So my question to you is, in your judgment, why is it that in the United States we end up spending double per capita of what you're spending in Canada?
Well, I think one of the obvious major drivers of costs in any healthcare system is administration. And in the U.S., we know that huge amounts of money, anywhere between estimates of 18 cents on the dollar to 30 cents on the dollar in the American system is spent on administration because you have so many insurance plans. And so people have to be paid to advertise those plans, to try to convince people to sign up to those plans, to process the claims, to deny the claims, to fill out the paperwork and count the beans. This is the administrative function, and in America, because there are so many payers, it's extremely onerous. If you look at a single payer system like the Canadian system or other systems, internationally, those administrative costs are very low. I mean, in my practice, it's very simple. We have about 40 doctors working in my family practice team. We have 2 people in the billing office. I have colleagues who work in the American system. Sometimes they say to me, we have as many billing clerks as we have physicians.
Sometimes more, by the way.
Right. So, we have 2 billing clerks, and once a month they submit one bill to one insurance plan, happens to be publicly paid for, and we get paid on time. That's it. I think one of the things that physicians may not understand in the U.S. is how what a joy it is to work in a system where you don't have to wonder whether you're going to be paid as a provider of healthcare services. We don't have to chase after our patients, try to get them pay their bills. We don't have to deal with insurance companies and ask them, do we have to get pre-approval for this? Is this, particular procedure covered for my patient?
Now, by the way,
there's none of that.
Sorry to interrupt you, but this is an issue, and I'm sure you have many friends who are American physicians, which has been very demoralizing for American physicians, who are trying to practice the best medicine that they can, and they have to fight with insurance companies as to whether or not they could use this type of prescription drug or this type of treatment. And it becomes they're spending an enormous amount of time arguing with insurance companies rather than doing what they wanted to do, which is actually to practice medicine. And by the way, it's not only the administrative cost, I think, for hospitals. Think about the amount of time that individuals in this country spend arguing with insurance companies about whether or not they're going to get the coverage for the procedures they thought were covered, and you do this when you're sick.
Right.
So I think what the evidence seems to suggest is we as a nation can save hundreds of billions of dollars by saying instead of having hundreds of separate plans where you have a $5,000 deductible and you have a $10,000 and you have a you have a $20 copayment, and you have a $50 copayment. One simple, comprehensive plan will save many, many hundreds of billions of dollars. Let me carry this discussion a bit further. There is an enormous amount of disinformation and outright lies about not only the Canadian healthcare system, but healthcare systems, universal healthcare systems all over the world. And one of them is all the doctors in Canada are just fleeing the country. They can't stand practicing there. They're all heading to the United States. That's why it takes so long to get across the border. What's the truth of that?
It's not true. So, the statistics on this have been collected over many decades. And in fact, for the last many years, of course, there are some Canadians who move to the U.S. There's some Americans who move to Canada. I think, for all kinds of different reasons. But the net migration, actually, for many years has been in the other direction. So there are more American physicians moving to Canada than Canadian physicians moving to the United States. And I have many colleagues who've gone to the U.S., often for highly specialized training. Your country is 10 times the size of ours population-wise. So you have many more medical centers than we do. And so it's not uncommon for Canadians to go to the U.S. for some part of their subspecialty training and come home. And so they don't choose to stay. I have lots of colleagues who've done that trajectory. And one of the reasons that they will often cite is that although they were grateful for the training they received and it was great education, et cetera, they didn't want to work in a system where they had to worry about whether or not their patients were going to be able to pay for their care. They wanted to come back and work in a system where they can focus on treating their patients.
And are Canadian physicians decently paid?
Extremely well paid, actually, by international standards. And in some specialties and subspecialties, they're paid more than their American counterparts.
Okay. Now, needless to say, the Canadian system is not perfect, nor is any system in the world. And I know you've just written a book, a bestseller on the Canadian bestselling list called Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. What do you see as the major problems today in the Canadian system?
And the most important problem that I see, and I see it in my practice every day, is the fact that our system does not include prescription medications when they're given outside of hospital. So when people are admitted to the hospital, they need IV antibiotics or they need, cardiac medication or whatever, anything they need, it's paid for. But as soon as they set foot on the sidewalk outside the hospital with a prescription in their hand, they're on their own. And so is
that true for all income levels?
It is not. We almost every single province has some public drug coverage. Often seniors are covered. Actually looks a lot like your system. You know, you've got Medicare for people over 65. You've got Medicaid for low-income people. We have often public programs that will cover people on social assistance. So it's often the working poor or people who are in precarious jobs. Many of it's a similar population to the folks who are uninsured in the U.S., but in Canada it's not an uninsurance for all health care. It's mostly around prescription drugs.
So you're in the same situation that American physicians are, that you may write out a prescription to a patient, and that patient may not be able to afford to fill it.
Absolutely, and I have patients who take their pills every other day or who take them for a few weeks and then, have to wait until the check comes in to fill it again. We have, so I mean, it's a big issue, a big problem, and it's because our system was designed in the 1960s when prescription medication was less of a focus of medical care. Today, it's a cornerstone of the management of chronic disease. I don't think you can have a well-developed universal healthcare system that doesn't include prescription medicines. And so doctors and patients and nurses and all kinds of groups in Canada have been pushing very hard to convince our governments to bring prescription medicines into our Canadian Medicare and include medically necessary prescription drugs. That, to me, is the next frontier for the Canadian system. And when your Medicare for All bill passes here in the United States, you will actually have a better plan than we do in Canada currently, because it will include medically necessary prescription drugs. So I hope that we don't. I hope that we don't fall too far behind you.
Let me ask you this. And by the way, we should mention that in terms of prescription drugs, here in the United States, many people, including myself, talk about Canada. In fact, I was the first member of Congress to go over the Canadian border to purchase medicine that was a fraction of the cost that it was here in the United States. But the truth is that compared to the rest of the world,
That's right.
Canada has very high prices. I think you're second in the world next to the United States. We're
That's
the highest.
right.
You're the second, and countries all over the world are selling the same exact medicine at a fraction of the price. Let me ask you this. Healthcare systems and healthcare policy doesn't evolve in a vacuum. It evolves within a political framework. Can you give us a minute to talk about how and when the Canadian healthcare system evolved? You mentioned, I think yesterday in your testimony, that your parents, your family suffered because they did not have the Canadian system was not around at that point. Talk about that and talk about the evolution of the Canadian system politically.
Yeah, so, I mean, it's not that old, the Canadian system. When my grandparents immigrated to Canada in the early 1950s, there was no universal health care, and they were essentially bankrupted by medical bills when my grandfather had a heart attack. And through the 1950s and into the early 1960s, there was a movement towards universal health care that began in one province, like our American states. So we had one premier, a Social Democratic premier, Tommy Douglas, who is now a Canadian hero and an icon, who started universal public insurance for hospital services and then medical services. And that model spread across the country, but it was not without a lot of resistance and it took a lot of political courage to do. And in fact, famously in Saskatchewan, the province where Medicare began in the early 60s, when Tommy Douglas implemented universal public insurance, the doctors went on strike. And there was a showdown between the physicians who at that time wanted to preserve their ability to charge patients and the premier who had the public on his side. And at the end of the day, there was an agreement that was reached, and Medicare soon spread across the country. And Tommy Douglas is now, in 2004, our Public Broadcasting Corporation hosted a competition for the greatest Canadian of all time. Canadians all over the country voted, and Tommy Douglas was the winner. And so he is really viewed through the lens of history as an incredibly brave person who took a stand on an issue of social justice, and he's a Canadian hero. but it wasn't easy. And having the public behind him and understanding the importance, having the nurses behind the federal government in the 1980s, when there was another resurgence of private medicine that needed to be taken down. These are very important moments in Canadian history, and at every turn it required courage on the part of politicians, and it required the public to stand up and say, we support you, we want this.
What Dr. Martin just said, I think, is profoundly important. And if anyone thinks that doing the right thing in terms of health care, which is guaranteeing health care to all people and having a cost-effective system, and taking on the drug companies and the insurance companies and Wall Street and the medical equipment suppliers and all those people who make hundreds of billions of dollars off of our current system, anyone thinks that's easy, or if that is just going to be done here on Capitol Hill, then you don't know anything about politics. And what Dr. Martin is just saying, in a sense, there was a political revolution in Saskatchewan. It didn't happen. You had a very brave, progressive leader and a party prepared to stand up, take on their entire establishment, take on the doctors at that time. But as I understand it, what happened is, because it worked so well in Saskatchewan, people all over the rest of the country are saying, hey, if they could do it in Saskatchewan, why not Ontario? Why not Quebec, et cetera, et cetera? Is that kind of what happened?
That's kind of what happened. And in fact, even and the physicians who were afraid that this was going to result in a government takeover of their practices and, not being well paid and all of this stuff, those fears have not come to pass. And I do think that it's important for Canadian physicians to share with American physicians our experience of this system. Nobody interferes in the practice of medicine out of our government offices.
So the truth is, I want to spend a minute on that one, is that the critics, the insurance companies and the drug companies and some of my colleagues here in the Senate, it's government-run healthcare. Are you a government employee, Dr. Martin?
I am not a government employee. I am self-employed, independent entrepreneur.
All right, but in a sense, you practice, for better or worse, by the way, unlike the British and other countries, which do have socialized healthcare. You practice very much the same way that most American physicians would practice, yes?
That's right. It's just that when I send my bill to the insurance company, it's a public insurance company instead of a private insurance company.
And that is it. So when you hear, as you will, 24/7 now, all of our critics saying this is a government takeover of healthcare, that is just nonsense. What changes is perhaps the color of your insurance card and what's on it. So instead of saying Blue Cross Blue Shield or instead of saying United Healthcare, it will be Medicare. And your doctor will be practicing in just the same way he or she practices today. You're going to go to the hospital that you want. And by the way, I don't know the answer to this with regard to Canada. You'll help us here. My colleagues here say that if you have a Medicare for all system, you're going to be limited in terms of your choice of doctor. Truth is now, under this system, this functional system, many people can't go to the doctor that they want because their doctor is not in their health plan network. What is the story in Canada? Can people choose the doctor they want?
Absolutely, you can choose the doctor you want because every doctor's in the network. There's only one network and everybody's in it. So you can choose any doctor you want. You can choose any hospital you want. You can go anywhere you want to get your care. The reality is that most people, get their care from their local hospital. They don't, most people are not in the business of traveling all over the place to get healthcare services. But some do, or some will travel to get a second opinion to some other location. So there are no restrictions on choice in that way.
So would it be fair to say that actually within Canada, you have more freedom of choice than you do in many parts of the United States?
Absolutely. I mean, there's no doubt.
All right, but the high cost, going back to your concerns about the situation in Canada now, high cost of prescription drugs, unaffordability of prescription drugs is a major issue. It's not the only one. There is concern about waiting time, for example. Talk about that a bit, please.
So this is something that gets a lot of press, right? I know south of our border, and people talk about the wait times. So the first thing I think is important for people to understand is that Canadians do not wait for urgent or emergent issues. So, if people get seriously sick in Canada, they have a heart attack or a cancer diagnosis or whatever, our outcomes are excellent for those serious conditions, and we don't wait any longer than anybody else in the world for those important things. Having said that, we do have a problem with wait times for what we call elective or non-urgent procedures. So people who are waiting to see a specialist for a non-urgent issue.
Give us some examples. Of what
So if I have a patient who has headaches and want the opinion of a neurologist about the management of their migraines, for example. Not because I'm worried that they have brain cancer. If I'm worried they have brain cancer, they'll get their MRI tomorrow, and the system will move very quickly. But if I have a patient who's got migraines and I need advice about how to manage it, they might wait several months to see a neurologist for a non-urgent problem like that, or non-urgent surgeries. The classic example being a hip or a knee replacement.
So how long will it take me in the
it depends on where you are in the country. Sometimes it's a few months, sometimes it's a year. In some places, sometimes it's been even longer than that people wait for a hip or a knee replacement. And I think that's totally unacceptable. I don't think that we should stand for it in our system. I think that there's no reason why people should have to wait. And what we have determined, and those of us who study these issues and work on these issues, is that although those waits are a problem, they are not caused by the fact that our insurance plan is paid for by the government. The reason that we have difficulties with waits is because we have done a poor job of organizing the delivery systems of care. So just to give you one example on the hip and the knee replacement issue, you might have 8 surgeons working in the same hospital who all do hip and knee replacements, and each of those surgeons keeps their own waiting list because they're independent practitioners. And one might be a new graduate, and I know this happens. I get these notifications. I'm a new graduate. I've just started. I have no waiting list. Please send me your patients. And one might be, 40 years into practice and have a 2-year waiting list. They're doing the same procedure. They're working in offices next door to each other. And so what we have discovered is you can dramatically bring down the wait time if those people be willing to share a waiting list. And the next available surgeon is the person who sees the patient. But that requires cooperation among healthcare providers. It requires the public to be willing to see the next available surgeon. It requires a change in the way that we organize our structures. And those are the kinds of solutions that we are moving to in Canada. When we've moved in that direction, it's made a big difference in our waits, but we're not there yet. And as you've said, no system is perfect. So these are the kinds of issues that we struggle with.
Let me ask you another question. And I honestly don't know how similar Canada is to the United States. I do know when I talk to young physicians in this country, they talk about, in some cases, being $200,000-$300,000 in debt, having gone through college and medical school and so forth. What about medical school in Canada? What kind of debt do people leave school with?
It's not as big as the debts that we hear people graduating with here, although there are certainly issues around medical student debt. Our medical education has become much more expensive. And one of the reasons that we worry about that, and I think we share some parallels with the U.S. in this, is that we want and need to recruit doctors to do work in rural areas, work with more marginalized communities, primary care work, et cetera. And so we worry that if you make a medical education inaccessible to people who come from lower income backgrounds, it's going to be harder to get doctors to work in the areas of the system where you need them most, because we don't tell doctors where to practice and we don't tell them what to do, but we need them to want to work where they're needed. So we do have issues with medical student debt, but they're not on nearly the scale that we see here in the U.S.
Talk about an issue which I have been working on for many years, and I know you've mentioned it in your book, and that is the need to expand our capabilities in primary health care. Mm-hmm. The truth is that in this country, there are many people, even those who have decent insurance, are finding it difficult to get a medical home, get to a doctor when they need. And I think you argue that a doctor that knows the patient, knows the life history, knows the family of that patient, is a much better provider than just somebody who provides episodic care. Talk a little bit about the importance of primary care in that sense.
It's critical. Every high-performing system of healthcare in the world is centered around a high-performing primary care system. And I do think that actually Canada is ahead of the U.S. in this, but we are not as far ahead as some of our, European comparators, for example. So 85% of Canadians now report that they have a family physician, a place of regular care, and most of our primary care is provided by family physicians. And in a high functioning system, that's where you go first. That's where you go first. It's where you're known. It's where a person can integrate their understanding of your other medical problems, of your life circumstances, of your situation over time, in order to help make sense of the particular problem or issue that you happen to have that day. And the evidence is very clear. In the U.S. as well as internationally, that systems that have a very solid core of primary care services deliver better quality, more equitable care at lower cost. And so it makes sense for all of those reasons. The question is, how do you build it? And how do you help people to understand that that coming home to that medical home each time as the beginning point of your journey in the healthcare system isn't just good for the system, it's good for your own personal health. And I think that the U.S. has traditionally had a system that's pretty focused on specialists and specialty care. And I think there's a lack of understanding maybe in some quarters about the importance of primary care services. So, yeah, I think that's a big challenge.
Okay, I think we can go on for a long time, but I think we're kind of running out of time. Anything that you'd like to add that we haven't discussed?
I think I just want to say that, for those of us who are north of the border, we feel we have so much in common with Americans, and we share so many values, and our biggest trading partner, and our closest nation in a whole variety of ways. But it is sort of inexplicable to us that people are really actually having conversations in this country about taking healthcare insurance away from citizens. And as much as we have challenges and problems in our system that we need to work on and fix, we would never trade it in for the problems that you've got, respectfully. And so anything that Canadians can do to help to explain how our system works and why we are so committed to it, that would help Americans to be less afraid of making this transition in your system. I can't speak for my whole country, but I know that myself and many of my compatriots would be very happy to do.
Well, you've gotten us off to a great start today. Dr. Danielle Martin, thank you very much for being with us.
Thanks for having me.